Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, in the variants of multiple sclerosis, we have Marburg's variant, and second is neuromyelitis optica and Devic or Devic's syndrome. This neuromyelitis optica or Devic's syndrome is actually an aggressive inflammatory disorder. It is also a variant of multiple sclerosis, but there is predominant acute optic neuritis is one of the important feature of neuromyelitis optica. Along with the features of myelitis are seen. Here in neuromyelitis optica, the optic neuritis is present, and these attacks of optic neuritis are most of the cases they are bilateral, or they can also be unilateral also. Okay, but mostly they are bilateral, and we also have myelitis are also present. Myelitis in neuromyelitis optica is severe, and we have transverse myelitis is seen in neuromyelitis optica. See, in multiple sclerosis, the bilateral optic neuritis is very rare in multiple sclerosis, because in multiple sclerosis, most of the cases, the optic neuritis is unilateral, and in multiple sclerosis, this transverse myelitis is very rare in multiple sclerosis. So, these two are the differentiating features of neuromyelitis optica. Then one more thing is this myelitis is longitudinally extensive, and this myelitis in neuromyelitis optica can also involve three or more contiguous vertebral segments. So it will involve three or four contiguous vertebral segments. So it is similar to transverse myelitis, but it is present only in 3 to 4 segments.
thank you and thank you for watching.